Chapter 7, the nursing process and standards of care. So this is an organization, QSIN, Quality and Safety Education in Nursing. You're going to hear QSIN throughout school, and you will hear about it all throughout your entire nursing career. So QSIN is an organization that focuses on safety and quality care of patients. The 6 competencies, as you see here, include patient-centered care, interdisciplinary teamwork, use of evidence-based practice, application of quality improvement, and the use of informatics. You can find this in box 7.1 on page 111 of your book to dig down a little bit deeper into this. So standards of practice for nursing. Official American Nurses Association publication for our class is Psychiatric Mental Health Nursing, which gives us the scope and standards of practice. And the basis is for certification criteria, the legal definition of psychiatric mental health nursing, and the National Council of State Boards of Nursing Licensure Examination, or the NCLEX RN questions. So the nursing process, let's look at the steps here. You have assessment. This is information collection, and when you gather your data, so for our purposes, this may be getting the mental status examination, of which you have a handout on. You may be doing a psychosocial assessment, a physical exam, taking their history, interviewing the client, and asking standardized rating scales, and you're also verifying the data here. Next is a diagnosis. This is information interpretation, and it's stating the problems and the strengths. So you're identifying the problem and the etiology of the problem. You're constructing a nursing diagnoses and a problem list, and you're prioritizing the nursing diagnoses. And then you have outcome and planning. This is setting nursing goals, desired outcomes, and planning interventions. So this is identifying attainable and culturally expected outcomes. Document expected outcomes as measurable goals. Include time estimates for those outcomes. Planning is identifying safe, pertinent, evidence-based actions, striving to use interventions that are culturally relevant and compatible with health beliefs and practices, and you document the plan using recognized terminology. Implementation is at the basic level is coordinating care, health teaching and health promotion, milieu therapy, which we will learn more about soon, and pharmacological, biological, and integrative therapies. At the advanced practice role, so your medical doctors, your advanced practice nurse practitioners, this is prescriptive authority and treatment authority, psychotherapy and consultation, and finally evaluation. This is where you document the results of the evaluation, and you document if outcomes have not been achieved at the desired level. So we must also use clinical judgment, and you're going to hear about the clinical judgment model all throughout the program. And we use this clinical judgment when performing patient care. You need to review the clinical judgment model as well as the nursing process model. So nursing process, the first thing we're going to do, we need to recognize our cues. Then we need to analyze those cues and prioritize a hypothesis. Now we need to generate solutions, take actions, and evaluate outcomes. Now this isn't to do with mental health, but to kind of give you an idea. You go into your patient's room and they look like they're struggling to breathe. You assess that. You put the pulse ox on their finger and you see that their O2 sat is 84%. Now we need to analyze clues and generate a hypothesis. Well, their O2 may be low because I gave them an opioid pain medicine 45 minutes ago. Now I need a solution. What can I do to fix this situation? Well, the quickest fix would be to probably put oxygen on the patient. So I'm going to take action and I'm going to put oxygen on the patient. And then after a few minutes, I'm going to evaluate that outcome. Did placing oxygen on the patient work? Did the O2 sat go up from 84% to something within normal range? If they didn't, then we need to start this process over again. And this works in all areas of nursing. So now we're going to talk about each standard for psychiatric mental health nursing, and we will start with assessment. So assessment begins with the initial encounter and it continues throughout the care given. So the purpose of the assessment is for the nurse to collect and synthesize pertinent patient data while following HIPAA guidelines. You gather information related to presenting symptoms and the patient's strengths. But there are age considerations. With children, parents are the best resource for understanding the normal behavior. Developmental levels are key. Both observation and interview techniques will be used. Adolescents, confidentiality is the biggest concern in this age group. So provide an overview of how information will be shared and what information will be shared. Determine risk factors is crucial and can be performed using the HEADSSS technique, the HEADS technique, which you will find on box 7.2 on page 112 of your textbook. And then finally, the older adults. Since body systems begin to diminish, do not stereotype and assume that they are mentally and physically deficient. Assess at the beginning for any physical limitations. And then language barriers, we've already talked about, but it is important to have a thorough understanding of factors that influence health and illness, so an interpreter or translator may need to be used. So next we're gathering data, and we're going to do a review of systems. It is important to rule out any physical cause for symptoms. And on page 114, box 7.3, gives you some psychiatric symptoms that are associated with medical conditions. During the review of system, the history includes co-occurring conditions, demographic data, dental health, vision, eye health, STIs, etc. Laboratory data, it is important to help rule out physical causes as mentioned previously. And then that mental status exam, I gave you a couple of handouts today on this. But this is foundation to the psychiatric exam. The mini mental status exam takes about 10 minutes and it assesses language, memory, attention, orientation, and visuospatial proficiency, so depth and distance perception. You can see box 7.4 on page 115 of your text for the mental status exam. Then you have your psychosocial assessment, and it begins with the patient's description of why treatment is necessary, and it should be documented verbatim. This is where you need to use your quotation marks. This should be done in a quiet, private environment and includes family history, work history, educational history, as well as substance use. And you can find this in box 7.5 on page 115. Your family assessment determines the ability of the family unit to manage life, deal with disagreements, and live with a determined set of boundaries effectively. Then you have your spiritual religious assessment. Spiritual and religious beliefs exert influence over a person's life because it gives them meaning and perspective. Cultural and social assessment includes healthcare beliefs, values, and practices of each patient. And then validating the assessment. You do this to gain a clearer understanding of your patient. So you look at the EMR, the electronic medical record, or previous medical records. You may look at police records because that can be helpful, but you also need to remember that consent forms need to be signed to gain access to those records. And then you may use rating scales. There are standardized scales used by clinicians for evaluation and monitoring, and you can see some examples of these in table 7.1 on page 116 of your text. So analysis, This is where diagnosis and outcomes identification, they're going to be included in this phase. So, diagnosis. Analyze assessment data to determine diagnoses, problems and areas of care, and treatment focus, including level of risk. But then there's types. You have your problem-focused diagnoses. These include a problem, a probable cause, and supporting data. But then there are risk diagnoses. This includes a problem the patient is at risk for rather than a current problem they have. Next is outcome identifications. So what are the expected goals for your patient, both short-term and long-term? Remember that these must be measurable so we can determine if the goals were met or not in the evaluation process. So the outcome criteria, we will identify expected outcomes that reflect the maximal level of patient health that can realistically be achieved through planned nursing interventions. The principles of outcome identification reflect a measurable desired change, provide direction for continuity of care, and they will be written in a positive term. You can refer to Table 7.2 for examples of long and short-term goals for a suicidal patient. In the planning phase, the nurse prescribes strategies to assist in attaining the expected outcome. They are established by the patient and facilitated by the nurse. So some principles to consider: is this safe? Is the goal compatible and appropriate for the patient's cultural values and personal goals? Is it realistic to the individual, and is it evidence-based? So implementation is putting the plan into practice, and the interventions are performed by the nurse. So coordination of care is one of the most important roles. This is where you advocate for your patient. Help teaching and help promotion. These are coping skills, self-care, stress management, etc. Pharmacological, biological, and integrative therapies. These are therapeutic dosing of medications with safe levels and assessing for adverse effects. Milieu therapy, you'll hear a lot about this semester. So you need to know that milieu therapy refers to the overall environment, both physical and social. Safe and secure environment in which teamwork and collaboration occur to provide the most comprehensive care possible. Therapeutic relationship is the foundation of the nurse-patient relationship. It provides reinforcement of positive behavior and coping skills. And advanced intervention, this can include advanced practice nurses with the ability to treat, prescribe, and conduct psychotherapy. Evaluation is the final phase, and it includes evaluation of the patient's progress toward attaining the expected outcomes and goals. The evaluation must be systematic, ongoing, and criteria-based. And finally, documentation is referred to as the seventh step, and it is crucial throughout all the steps. It includes the patient's condition, informed consents, drug reactions, patient concerns, and adverse incidents. Remember that the medical record is a legal document. Then we have documentation of non-adherence. The term non-adherence is used rather than non-compliant, as this term sounds judgmental. You can see Table 7.3 on page 120 of your book. Narrative versus problem-oriented charting, which is very helpful. And then you can see box 7.6 for legal considerations in documentation of care. I would be familiar with this box.